Chapter 3: Powers and Responsibilities of Government. Welcome back to our public health series. In this chapter, we explore a fundamental question: who is responsible for protecting the public's health in the United States? The answer, as we'll see, isn't simple. Public health is a complex, shared effort, spread across federal, state, and local governments, each with distinct roles, powers, and responsibilities. Let's break down this intricate system. Public health and government. Who's in charge? Ultimately, governments have the responsibility of making the organized community efforts necessary to protect the health of the population. Government's role is determined by law, that is, its public health activities must be authorized by legislation. These laws are further defined by court decisions and implemented by administrative agencies that issue regulations. The ultimate authority for these laws comes from federal, state, or local constitutions or charters. Meanwhile, many non-governmental organizations, or NGOs, also play vital roles, especially through educational programs and lobbying. There's also an increasing emphasis on broad community involvement, expanding the public health system to include hospitals, businesses, and charitable organizations. Federal vs. State authority. Interestingly, the US Constitution never explicitly mentions health. So, under the 10th Amendment, which states that powers not delegated to the US are reserved to the states, public health has primarily been a responsibility of the states. Most state constitutions provide for public health protection, and states have long established laws covering things like immunizations, sanitation, and safety regulations. However, the federal government also plays a major role, thanks to its constitutional power to regulate interstate commerce and promote the general welfare. These powers justify agencies like the FDA, which oversees products crossing state lines, and enable the federal government to provide funds to states subject to certain requirements, such as tying highway funds to state motorcycle helmet laws, which significantly reduced deaths. Medicaid funding is another prime example of federal influence over state health programs. How the law works. When it comes to how public health law works, it follows a familiar pattern. First, a legislature, perceiving a need, passes a statute. Since health issues are often complex, these legislatures authorize administrative agencies to set detailed rules and regulations to accomplish the legislation's purpose. If there's a legal challenge, courts then step in to interpret the law and determine if the agency actions are within its legal authority. One of the most famous public health legal precedents was Jacobson versus Massachusetts in 1905. The Supreme Court upheld the state's authority to require smallpox vaccination, ruling that individual freedom can be limited by the state, for the common good. Police powers in public health. To protect public health, governments use what are called police powers, their inherent authority to act in ways that can curtail individual rights. These powers are invoked for three main reasons. First, to prevent a person from harming others. Second, to defend the interests of incompetent persons, such as children or the mentally disabled. And third, in some cases, to protect a person from harming himself or herself. This is the basis for laws like quarantine measures during an infectious disease outbreak, restaurant inspection standards, or even mandatory seatbelt laws, demonstrating government's foundational responsibility for public health. Local public health agencies. The day-to-day work of public health primarily happens at the local level. The most common local agency is the county health department, though large cities may have their own. These local health departments are responsible for core tasks within their jurisdiction, including collecting health statistics, running communicable disease control programs, providing screenings and immunizations, and conducting sanitation and inspection programs. Their services, however, vary widely, heavily dependent on how much funding and authority they receive from state and federal sources, as well as local property taxes and fees. State health departments. As we learned, states hold the primary constitutional responsibility for protecting the health, safety, and general welfare of their populations. State health departments oversee and coordinate the activities of local health departments, often providing significant funding and channeling federal funds to local areas. They are also typically charged with licensing and certification of medical personnel, facilities, and services to maintain standards of quality of care. Additionally, states have a significant role in administering the Medicaid program, which is a joint federal-state initiative providing healthcare for the poor, though their authority is limited by federal guidelines and their heavy reliance on federal funds. Federal public health agencies. At the federal level, most traditional public health activities fall under the jurisdiction of the Department of Health and Human Services, or HHS. Key agencies include the CDC, the Centers for Disease Control and Prevention, which is the nation's main assessment and epidemiologic agency, focused on controlling and preventing diseases globally, the NIH, the National Institutes of Health, which is the largest biomedical research complex in the world, funding research into virtually all human diseases, and the FDA, the Food and Drug Administration, which regulates the safety and effectiveness of foods, drugs, vaccines, and medical devices. Beyond HHS, the EPA, or Environmental Protection Agency, established in 1970, is the prime federal agency focused on environmental health issues like water and air pollution, often a controversial agency. The role of NGOs. While government bears the major responsibility, many non-governmental organizations, or NGOs, play incredibly important roles in public health, especially through education, lobbying, and research. These include specific disease organizations like the American Heart Association, professional membership organizations such as the American Public Health Association, and major philanthropic foundations like the Bill and Melinda Gates Foundation, whose mission is to improve global health. Consumer and advocacy groups, like Ralph Nader's traffic safety campaign in the 1960s, have also had major impacts on policy. As the Institute of Medicine emphasized, governments alone cannot achieve public health objectives. Successful public health is dependent on its ability to obtain the participation of other agencies to solve its problems. This makes negotiation and coalition building vital skills for public health leaders. Coordination across sectors. Public health cannot succeed in isolation. Whether responding to a pandemic or reducing chronic disease, it requires seamless coordination and collaboration between all sectors of the community. This includes government agencies at federal, state, and local levels, local non-profits, hospitals and other healthcare providers, businesses, schools, the media, and, of course, the general public itself. As highlighted by the Institute of Medicine report, public health depends on partnerships, and those partnerships rely heavily on strong leadership, effective communication, and adept coalition building to achieve shared goals. Conclusion. So, who is ultimately responsible for public health? It's a complex, shared endeavor. While government bears the primary responsibility as an organized community effort, it's truly a collaborative framework. States hold the primary legal and constitutional authority for public health. Local governments, being closest to the people, provide the bulk of day-to-day public health services. And despite not being explicitly mentioned in the Constitution for Health, the federal government has established a significant presence, leading, funding, and regulating issues with a national scope. Ultimately, a successful public health enterprise demands the active involvement of all sectors of the community. It's a complex web, but one designed to serve a single, critical goal: protecting and improving the health of all people. Thank you for watching. Like, subscribe, share. See you in Chapter 4, Epidemiology, the Basic Science of Public Health. Thank you for watching Chapter 3 of our Public Health video series. If you found this helpful, please don't forget to like, subscribe, and share it with a fellow health student or professional. Join us next time in Chapter 4, where we'll dive into epidemiology, often called the basic science of public health.